America has become the most sports-conscious country in the world. Each year, millions more participate in sporting activities, and that means there are more athletic injuries. Many of these are muscle problems. And this has brought about the need for specialization in the massage therapy profession. This new field is called clinical sports massage. Clinical sports massage is the use of specific massage techniques designed to, one, enhance muscle recovery from strenuous activity, thereby improving performance, and two, to promote recovery from athletic injuries. Sports activities demand that the athlete be strong, flexible, and have endurance. To attain these qualities, many hours must be spent in training. This often leads to overtraining symptoms such as fatigue, tendinitis, and muscle strains. Clinical sports massage can be vital to the success of an athlete because it can directly affect each of these symptoms. This in turn will contribute to the athlete's highest level of performance. Clinical sports massage techniques can provide the answer to common sports-related muscle and tendon complaints. In this video, one of the most respected sports massage therapists in America, Benny Vaughn, will demonstrate some key massage techniques. These procedures can produce the best results for common muscle tendon problems. To demonstrate upper body techniques, we have chosen an Olympic swimmer. With the tremendous stresses put on the upper extremities both in training and competition, often produce a variety of common and muscle tendon complaints.
I'm here with Dara Torres. Dara has been a member of 2 U.S. Olympic teams. She's won a gold medal, a silver medal, and a bronze medal. She is a 28-time All-American while swimming for the University of Florida. She's the former world record holder for the 50-meter freestyle. She's also the former U.S. record holder for the 100-meter freestyle. We'll be working with Dara today on some of the various types of problems that can be helped with the use of sports massage. These areas that we'll be investigating revolve around the shoulder and the upper extremity. In order to take a look at the various approaches that the sports massage therapist can use for the swimmer, we have to investigate the various aspects of shoulder movement. In order to do that, let's investigate those 6 distinct movements that are produced by the shoulder joint. First, the shoulder is able to abduct, or it moves away from the body. The shoulder joint also adducts, moves towards the body. The shoulder can also internally rotate and externally rotate. The shoulder also flexes and extends. When we take a look at these 6 movements that Dara will now perform again for us, you will notice that any swimming movement that occurs is a combination of 2 or more of these movements: internal rotation, external rotation, flexion, and extension. When we begin to investigate what type of massage therapy would be best for the swimming athlete, it is oftentimes necessary to muscle test those areas that are responsible for that movement at the joint. So what we'll do now is take a look at those 6 tests and the ramifications of doing those tests to determine what will be the best sports massage techniques for that swimming athlete's complaint. When investigating the swimming athlete, it's important to determine whether there is any measurable strength loss. This can give the sports massage therapist an idea as to where the problems may exist that swimmer is complaining about. Before doing this test, it's important to inform the swimming athlete exactly what movements you expect them to do. Once they know what movement is expected of them, then apply general pressure to the area in order to accent that muscle that you're testing. So we'll begin first by having Dara bring her arms up to her side so that the deltoid muscle is the primary muscle being utilized. Once Dara knows the particular movement that's required of her, we will then apply pressure at the elbows while we ask Dara to resist. So as I press down, Dara resists, and we have an opportunity to determine whether there is any significant strength loss between these two deltoid muscles. Dara brings her arms down to the side, and we begin the second movement. The second movement that we're interested in will be what happens when Dara extends her arm. By extending the arm, we are facilitating movement of one of the most powerful muscles used in swimming, the latissimus dorsi. This latissimus dorsi muscle moves the extremity in this posterior fashion and oftentimes can be the subject of much pain and discomfort for the swimming athlete that oftentimes is misevaluated as a shoulder joint problem when in fact it's a muscle tendon attachment problem that comes from that latissimus dorsi. So we explain to Dara what we'd like her to do. She's going to bring her elbow back so that she's extending the arm, and as she extends the arm, I will apply pressure against that movement. So as she pushes back, we are able to accent and place additional stress on the latissimus dorsi in order to determine whether there is any significant strength loss or pain associated with that movement. It's always important to do both sides in order to make a comparison on the side where there's a complaint and the side where there's no complaint. So in order to balance this, we have her produce the same movement on the side that's affected. We make a comparison and determine whether we have a significant loss of strength. As we continue with the evaluation technique, we simply move to internal rotation. By having Dara keep her elbows close to her torso, her forearm and arm are at a 90-degree angle, and we explain to the athlete what we'd like them to do, and then we simply apply resistance while they perform the movement. So Dara will bring her arm in towards her abdomen in this fashion, and then I will simply apply some resistance while she makes that movement. And by doing that, we're able to apply stress to those muscles around the shoulder joint that are responsible for internal rotation. Again, always make a comparison between the affected extremity and the unaffected side. Now we'll simply repeat this again with Dara performing external rotation. So we demonstrate the movement that we'd like the athlete to make, and then we simply apply pressure against that movement as the athlete performs. So as Dara externally rotates, we apply pressure, and again, we make a comparison between the unaffected and the affected side in order to determine where exactly the complaint area may be and to help us determine what type of massage treatment would be appropriate.